And Patrick Ladbury, Director of National Social Marketing Centre in the UK, has been commissioned by government to develop a social marketing plan to introduce behavioral change practices among BVI residents to stem the increase of chronic non-communicable diseases. Speaking on a special JTV Spotlight program on Wednesday, February 27th, Ladbury said the plan would consist of an overall wellness program.
18 months ago, the government approved a strategy for managing the non-communicable diseases within the BVI, and so my role is to look at how we can implement that, and how we can measure the changes involved, and how we can develop an overall strategy. And what we're looking at is coming up with one program that looks at improving the health of the BVI, rather than just looking at alcohol, or we're looking at smoking or physical activity. We're looking at an overall wellness program, to putting it together, so making that it's everybody's business. Health is everybody's business, not just the Ministry of Health or the health professionals, the doctors. It's everybody's business.
Concerns about the high number of cancer-related cases here in the Virgin Islands were raised by a First District resident at the Abraham Leonard Community Centre in Carrot Bay on Monday, February 25th, when government began the first in a series of on-the-road community meetings. Minister for Health and Social Development Ronnie Skelton acknowledged that there is an increase in the number of cancer-related cases as well as other non-communicable diseases in the BVI.
Cancer is a serious disease, a serious health issue in the whole country. We have, and when I was here the last time, we commissioned a study to see what is causing this stuff. But we got out of the office shortly thereafter. I have asked the Chief Medical Officer, Dr. Potter, to let us see if we can start the process again to find out what is causing so many cancers in the BVI population, whether it's something in the air, in the water, or something we have done in the past that is causing cancer to be so prevalent in our society. Non-communicable diseases, hypertension, diabetes, it's like a cancer. When we were here the last time, we had 13 people in dialysis. Now we have 56 climbing. So we have some serious health issues in the country. And I can stand here and tell you we don't have all the financial resources to solve these problems.
To reduce the rate of non-communicable diseases, the director of the UK-based National Social Marketing Centre says will take about 10 to 15 years to change behavior in what people eat and to begin exercise routines. The work, Ladbury says, has to begin promptly because there will be serious implications for the national budget. Unless
the prevention work starts now, and one of the things we're looking at is the costs that are going to rise over the next years to the BVI, and saying to the government, people, look, this is how much it's going to cost. We have to do something now, and we have to change the behaviours now. Otherwise, it won't be sustainable, and the budget will have to go from certain other areas of spend from the government. So it's a pressing need to start now, and it's a long-term thing. These behaviours don't change overnight. You can't switch them on and off. The culture's changed in the BVI over the last 40 years in terms of what people eat and the physical activity they do. It's going to take a long time, 10, 15 years, to try and halt this rise in obesity and blood pressure and other diabetes, and then start to see an improvement.
A 2008 report by the Organization of Eastern Caribbean States and the United Nations Development Programme, the UNDP, has identified chronic non-communicable diseases such as diabetes, hypertension, and obesity, along with depression and substance abuse, as major health problems facing the BVI. The report also says that in 2004, the top 3 causes of death in the BVI were cancers, hypertensive disorders, and coronary artery disease.